I feel like my placement has really prepared me for what after nursing school would look like, because it has taught me how to provide holistic care for a patient, how to establish therapeutic communication with a patient. It has taught me time management, definitely, because on a day-to-day basis, we might have like 2 patients or 3 patients, and it has taught me how to prioritize care for these different patients. And we have to wake up early every day, sometimes 6 a.m., sometimes 6:30, but just to get to clinicals before 7. So it has definitely taught me time management. My name is Mmesoma Nwanonenyi. I am from Nigeria, and I'm in my 3rd year of nursing at Lakehead University. I first heard about Lakehead through an agency, and I saw like small class sizes, the professor interactions with students, so that was one of the reasons why I chose Lakehead. I would say a time a professor made a significant impact was my med-surg class. I had this professor called Aduno. She made sure her students understood everything she was teaching. I remember I had a problem actually reading an ECG, so she took her time to explain it in-depthly. So I would say that this was one great experience I had with my professor. One advice I would give to someone coming to study nursing in Canada is be prepared. Some stages or some times it feels really hard or tough, or it feels like you can't do it or you can't move on. But definitely have friends who are pursuing the same goal, whose goal is to become like a confident, compassionate, competent nurse. So have friends that have the same mindset as you, and also do not be afraid or do not be shy to talk to your professors where you have problems or where you don't understand a concept, and be eager to ask questions in clinicals where you feel like you don't understand or you don't know what you're doing. So asking questions, having friends that align with your goals, that is one thing I would tell someone who is coming to Canada to study nursing. I would say the nursing program did prepare me for clinicals, because before every clinicals we have labs, and in these labs we have patient scenarios where we come to practice IV meds, medications, vitals, assessments, or any skill at all you're not comfortable with doing in clinicals. And as well as there are also practice labs every Thursday, which has definitely helped me prepare better for clinicals. My clinical placement is our Thunder Bay Regional Health Sciences Center, and I am opportuned to be on 2B, which is a medically inpatient unit. So a typical day-to-day interaction is coming into the unit, getting reports from the previous nurse, and knowing who the primary nurse for the patient is, because this is the nurse you're going to give communication to about everything that's going on for the patient. Then you go into the patient's room and introduce yourself, tell them what you're there to do for the day, do some physicals and vitals on the patient, give them their medications, and while all these are going on, you make sure that you give every report you have to the primary nurse. I feel like my clinical placements have really enhanced my studies because, for example, I was doing a course called medical surgery on older adults. So going into the clinical setting and seeing the pathophysiology you've learned in class transform, like you see real life. So it teaches you how to actually carry out complex terminologies you've learned in class, transform it into a patient care. And this clinical placement has taught me how things have been taught in class is very important in providing everyday day-to-day care for a patient. My past clinical placement has influenced my career goals in the sense that I did a placement on 3C, and I was opportunity to take care of patients who come out from surgery. And on this particular day, it was the end of our placement, but I was opportunity to give CPR to patients in the ICU. So this experience transformed my thinking, or wanted me to lean towards working in the ICU or emerge. Lakehead University, a truly Canadian experience.